The Montana legislature approved expanding Medicaid in 2015. Then in 2019, they agreed to extend the program through 2025. But both times, the issue split majority Republicans. Now, with Republicans continuing to control the legislature and also holding the governor's office, leaders will have to decide whether the expansion will continue and whether to make changes to the program.
We've created a program that's working extremely well, and it's been a huge benefit for Montanans, and especially in the mental health and addiction areas, and to lose that would be catastrophic for the state.
Republican Representative Ed Buttry of Great Falls sponsored Medicaid expansion in 2015 and 2019, and he says he's planning to bring a bill this session to simply remove the sunset date. Buttry says the goal was that expansion would both get Montanans healthier and keep more of them in the workforce, and he believes it's been a success.
We heard a lot of things. We heard it would bankrupt the state. We heard that once folks get on the program, they'll never get off. And that, like I said, we now have 10 years worth of data that shows the exact opposite to be true. It's been a net positive for our state budget and the taxpayers. People are going off of the program once they get the help they need.
After reaching as high as 125,000 in 2023, the number of adults on Medicaid expansion in Montana was down to just over 77,000 in September 2024. That decline started after the Montana Department of Public Health and Human Services resumed eligibility redeterminations after the end of the COVID-19 public health emergency. Once again, Republicans are split on extending Medicaid expansion. Matt Regier, the incoming Senate president, voted against expansion in 2019 while in the House, and still opposes it today. He calls it a welfare program, argues it's helped hospitals more than individuals, and says there should be a closer look at options like requiring recipients to work.
It is taking taxpayer money and giving it to somebody else in the population. I'm all for, too, of a safety net. It's the question that we're going to have to answer is, when does a safety net become just a lifestyle and not a safety net anymore?
Governor Greg Gianforte told reporters last month that he was including Medicaid expansion in his budget proposal for 2025, but he wants to see added work requirements. The state already approved requirements for work or other community engagement in 2019, but hasn't received a federal waiver to implement them. Buttry says he hopes Montana will have another shot at getting that approval once the Trump administration takes over. Democrats joined with some Republicans to pass Medicaid expansion initially, and they say it's again a priority for them to get it extended. They say they're open to discussions about new ideas, but believe what Montana already has compares well against other states.
I think that we've got a lot of data that shows Montana's Medicaid program is working, and a lot of data that shows some of these other programs are not.
The legislature will get underway here at the state capitol on January 6th, 1 week from Monday. That will be just under 6 months before the current sunset date for Medicaid expansion, June 30th. In Helena, Jonathan Amberian, MTN News.